Peter Sanders was shocked to hear that his daughter's school, Grandview Elementary, has one of the lowest measles vaccination rates in the city. Only 57% of the students are on record saying they got the vaccine.
Yeah, that kind of surprised me that it's lower, the lower end.
Sanders vaccinated both of his children and was hopeful others had done the same.
Vaccines don't just work on the individual, it's that everybody vaccinated together helps protect the community.
To stop the spread of a disease like measles, enough people need to be vaccinated. That's called herd immunity. And for it to work, 92% of people need to be vaccinated. But there are plenty of schools in the Vancouver coastal health region that are nowhere near that threshold. Vaccination rates for the measles range from a high of 89% in Vancouver South to a low of 74% in the city centre. That's the lowest in the entire Vancouver coastal health area and is tied with Sunshine Coast. The highest reported vaccination rate is in Richmond with 93%. But the data isn't perfect. It only accounts for parents who have reported their kids' vaccination status to health authorities.
We need parents to meet us where they can and produce those records for us.
Health authorities believe more kids are vaccinated than the data shows, but not enough.
We should have vaccine rates that are essentially 100%, and we know we're not there.
And the trend on who isn't vaccinating their children might surprise you.
The higher socioeconomic, more educated parents who may have concerns or may have read something on the internet.
With the recent outbreak of measles, the province's health officer wants to tighten up reporting requirements.
Mandatory reporting of immunization status on school entry when you transfer schools.
She says making vaccines mandatory isn't as effective because it alienates parents. But having more accurate data could help them track down the students who aren't immunized and ask why. Tina Lovegreen, CBC News, Vancouver.